Hey, everybody, and welcome back to the Beat Podcast. This is Saul Marquez, hosting live from Los Angeles at the Vive event. Today, I have the privilege of hosting the amazing Mary Varghese Presti. She is the GM of Dragon Medical, an AI-powered voice assistant used by clinicians to document in the EHR. Mary leads the development of Gen AI-based clinical workflows for Microsoft Healthcare and Life Sciences. She's a seasoned healthcare executive whose career spans nursing, policy, big pharma, and big tech. Mary, thanks so much for joining us today.
Thanks for having me, Saul.
A true pleasure and super excited to get into our discussion. What are some of the biggest challenges you're seeing in the nursing industry today?
What are we not seeing? First of all, there is just the workforce abuse situation that's going on in some settings. There's the strikes. There's the higher acuity of patient load. There is the turnover. There is the cognitive burden. There's the wanting to go into the profession and take care of patients, but spending a lot of time doing things like documentation and technology. There's a myriad of things that are going on. But I guess at the end of the day, the biggest problem is the shortage. And we're at a crucible moment right now in the industry because nurses are leaving. They're leaving for a lot of different reasons. And it's really important to get under that and really understand and figure out how we're going to solve it, because we are all going to be either current or future patients at some time, and we need to make sure that there's a nursing force there to take care of us.
Totally. Yeah, it's a big issue, and it hasn't gotten better since the pandemic's ended. It's actually gotten worse. Can you explain how Microsoft and Nuance are developing a solution tailored to nurses and their specific needs, and how AI plays a role in that?
Yeah, so just to go back to the point you just made, it's not getting better, but more people entered nursing school as a result of the pandemic. So we're actually graduating nurses. It's just that after a short period of time, they leave. So I think that's really interesting because the pandemic burned out a lot of people, but it also inspired many to go into the profession. We have a long history in terms of supporting clinicians with their workflow, really using voice. So Dragon is an iconic brand. It's been around for decades. There's really not a physician you can find who hasn't used it at some point. And so we really honed our craft around the accuracy, the voice capture, to the point where physicians are using it as a third hand every day during their day to document in a way that is an experience that they can get through so that they can actually get home to their families. Mm-hmm. When we think about doing that for nursing, they share the same arc of burnout, but the way that they document and the way that they work are very different from physicians. So nurses, we believe they need to be hands-free, they need to be eyes-free, they're on their feet. They're constantly talking to patients, caring, comforting them, observing them, evaluating them, helping them up. So this is just a part of their day-to-day. And so how do you actually bring something that is meaningful enough for them to use? Because the standard to beat is paper. You see it all the time. They're writing on paper still, even though there are systems that we all have in terms of records, electronic health records. And if it's not paper, it's on their hand, it's on their scrubs. And so they're just incredibly busy, and they always put the patient first. And what's happening more and more is that there's a book of activities and tasks that are coming in between that. And so the way that we're looking at it, and really with the advent of these advanced generative AI and these more advanced large language models, it's really broken open the capabilities that we have now to use technology to solve these problems. But the magic is understanding exactly what is the use case that's going to make a difference for the nurses.
Thank you for that. Yeah, there's big opportunity. You really call out some very real examples of how we could help nurses with this. And looking ahead, how can organizations ensure that nursing technology with AI is implemented in an intentional, responsible way?
First of all, nurses have to be at the table, and they have to be at many different tables. I think for a long time, they've been this lost workforce where we expect everything of them, but we put them last when it comes to investments and technology plays. And so I'm super excited to see the space that we're in right now. And they say necessity is the mother of invention, but we are starting to see a lot of change across health systems in terms of the way that they're prioritizing budget or really trying to figure out what they can do to innovate around what they would say is their nursing crisis. Like I said, first of all, they have to be at the table. Second of all, Microsoft is the leader in really laying out a framework around responsible AI. The rigor at which we have to go through before we can launch an AI product is it's a very high bar. So whether it's inclusiveness, fairness, transparency, security, privacy, there is a very significant set of checks and processes from testing to bias, all of it that we have to go through. And we do that with our clients, with our development partners. So I think it's really important to ask good questions. I think it's important to know where you're quote unquote buying your AI from, because we are in this new era and we're just at the beginning of it. There's tons of promise, but we have to really approach it with a pragmatism in terms of developing it the right way, developing it so there's real utility. And for us, we are very focused on adoption, because I think you can create the best product in the world, but if it's not going to get used, if it's not going to get adopted, it's going to sit there. And so we spend a lot of time thinking about what are the ways in which we need to develop it? What are the ways in which the experience has to be accretive to the nurse's day to make it a solution that they're going to adopt and see meaningful use out of?
Yeah, no, some great points there, from adoption to getting into it with a very clear framework, right? The different things that you need for ensuring that technology is going to be responsible across the different things that you mentioned is critical. Can you share some of the most exciting technological innovations you believe will significantly improve patient care and outcomes?
Yeah. So first of all, in the United States, in our healthcare system, we have what I would say ultra high technology medicine. But where I think there's a lot of opportunity is really applying innovation around the provision of care. And that is really focusing on the providers. Because if you can really support them and transform the way they deliver care, then you elevate the patient experience for everybody and you drive quality outcomes. We've seen a lot of effort around physicians. And this is an opportunity now to really think about the nurses. And from that, other members of the care teams as well. So one of the areas I'm super excited about is what we've seen around virtual nursing. So you see nearly every health system experimenting, innovating, or going at scale with different platforms that are about bringing that experienced nurse back into that room in a way that is preferable for them, right? They've left the bedside, but they have tons of experience to bring. And really in every other industry, we've gone remote. So you're seeing that change. You're seeing different units try different things and really change the model of nursing care delivery, because in some units it might be, we want that nurse to really do a preceptorship through virtual, because we have, on average, most of the nurses that are actually at the bedside these days have less than 3 years of experience. So here's the way to partner that nurse up with very experienced nurses. Then there's the whole, admission and discharge. It's very time consuming. You really need to be thoughtful. You need to be very engaged. And you need to have the ability to do that without interruptions. Is that a piece that we could do remotely so that the nurses on the floor can focus on other things? So you see a lot of experimentation in terms of how might we augment the way that nurses are staffed and the way that they go through their shift. And they're all doing it differently, and they're all finding different ways to find ROI. And I think that's wonderful. I think that's going to bleed into more and more technologies that also start going into that intersection between that patient and the provider, and also between the provider, the physician, and the nurse, and also between the nurse and the broader care team. As we start getting into those areas with more investments in technology, I think that's where the provision of care, not necessarily the high-tech medicine that we all do have in this country, but that provision of care is actually going to be transformational.
Love that. Yeah, I think it's very promising. And the different angles that you shared could really be beneficial to a lot of the nurses that are practicing today. Artificial intelligence and machine learning are buzzwords in healthcare. In what ways do you see these technologies making a tangible impact both on providers and patients?
AI has been around for quite some time. Dragon Medical is AI, it's voice powered. I think that what we're going to see in the future, because we are in this very beginning of this era, is it's going to be ubiquitous. We are going to see co-pilots for all sorts of different roles to do all different things. But I think that some concerns around AI is going to take jobs. I think the way that we've all adapted around technologies to date, right, whether it was the internet or mobile or social media, is it changes the way that you work. So with AI, I think you can pick off certain tasks and then augment the person doing those tasks so that person can actually focus on perhaps different things that they wish they could be doing if they weren't doing these other things that might be a little bit redundant or could be automated. So I think those are all great opportunities. I do think that we see voice as the new user interface. We think with ambient, with all of these technologies where you can just speak, that is a tremendous way to really think about AI changing sort of the way that you go through your day. When the Microsoft Suite Copilot's now being rolled out, and it's great. You can choose to use it. I choose sometimes to use it. I choose sometimes to turn it off. I choose to see as a bake-off, do I like that better or not? But it's an augmentation. It's an assist. And I think we all could benefit from that.
Love it, said. We definitely can all benefit from these new technologies in our day-to-day, and especially health workers. I really can't thank you enough, Mary, for spending some time with us, sharing the insights that you and the Dragon and Microsoft team have. What closing thought would you want to leave the listeners with today?
I guess I would say be open. We are really in this amazing time. We don't know what's going to be, but I think it's if we all put our heads together and make sure that we're focused on the right problems, I think we're going to come out ahead.
Thank you for that, and certainly excited to see what you and the team do to give us a bright future. Thanks, Mary.
All.